Vaginal yeast infections, also known as vaginal thrush, affect 75% of women at some point in their lives. In this video, I will cover the cause of vaginal yeast infections, the common symptoms, treatment options, and what to do if your symptoms don't go away. The fungus Candida albicans is responsible for most cases of vaginal yeast infections. Under normal circumstances, a delicate balance of bacteria and yeast naturally lives in your vagina. The bacteria Lactobacillus naturally acts to prevent an overgrowth of vaginal yeast. When something upsets the balance in your vagina, an opportunistic fungal overgrowth can result in a vaginal yeast infection. Some known triggers for causing vaginal yeast infections include the recent use of antibiotics, which kill the good bacteria, the use of irritating body washes and perfumed soap, pregnancy, and those with poorly controlled diabetes or a weakened immune system, including patients with HIV or those receiving chemotherapy. It is important to note that vaginal thrush is not considered a sexually transmitted infection. However, it can be shared between partners during sexual intercourse if one of you is already infected. What do infected women experience? Some of the more commonly reported symptoms of vaginal yeast infection include itching and burning sensations, which are typically worse when urinating or having sex, an odorless cottage cheese or watery-like discharge, discomfort and tenderness in the vagina, and for some, a slight swelling of your vulva area. Treatment. If you think you may have vaginal thrush, it's important not to worry. Several over-the-counter treatment options are available. If your symptoms are vaginal, i.e. internal, it's best to opt for either an oral antifungal tablet or vaginal pessary. Topical antifungal cream such as clotrimazole are better for external symptoms. When using these medications, it is important to know that antifungal creams and pessaries may damage condom, diaphragm and caps. Therefore, if you use any of these, avoid sex while undergoing treatment. When to speak to a doctor. If you're pregnant or breastfeeding, speaking with your doctor first is best, as oral antifungal medications are unlikely to be safe. Additionally, if your symptoms aren't improving despite over-the-counter medications, or you're experiencing recurrent bouts or infections, particularly if more than 4 in the last 12 months, you should consult your doctor. The reason being is to ensure it is vaginal thrush causing your symptoms and nothing else. Your doctor will review your symptoms and consider performing an examination. The doctor may take a vaginal swab, or you may be asked to complete this yourself. This helps to confirm the diagnosis. If a persisting or recurrent vaginal yeast infection is diagnosed, you may require a treatment regime change. This may mean a longer course of treatment, plus further investigations to try and identify the cause of your recurrent infections, such as undiagnosed diabetes. Prevention of infections in the future. To reduce your risk for vaginal yeast infection in the future, try to wear breathable cotton underwear and avoid tight-fitting clothes. Whatever you do not perform vaginal douching and steer clear of perfume products and unnecessary use of antibiotics. I hope this information video has been helpful. I wish you all the best in treating your vaginal yeast infection.